Welcome to another episode of the Federal Newswire's Business of America podcast with your host, Jerry Rogers.
Well, welcome to another episode of the Business of America. We talk to the innovators, the entrepreneurs, the scientists, the doers. Teddy Roosevelt said that there are men and women in the arena, men and women who make America work. And that's who we highlight here on the Business of America. And I'm excited for this week's guest, Mark Walker. He serves as the Chief Executive Officer and Chairman at Performance Kitchen, which is very exciting. He also serves as Chairman and Managing Director at the athlete-based investment firm Dugout Ventures, which I have some questions about that too, because you partner with some real good baseball and sports guys. But Mark, welcome. Welcome to the Business of America. Before we get started, I have notes with lots of red lines on it because I have so many questions for you. But before that, tell us a little bit about yourself and Performance Kitchen and what's going on.
Yeah, well, thanks for having me, Jerry. Appreciate you taking the time. It's funny you bring up that Roosevelt quote, man in the arena. It's literally one of my favorite quotes on the planet. Like, the stuff is hard we're doing, man. Early stage businesses, small business, and you got to roll your sleeves up, get your hands dirty a little bit to make it work. But a little bit about me. I'm a CPA by trade, started an investment group probably 8 years ago now, Dugout Ventures. We invested in a small little food company brand, and probably about 5 years ago now, called Performance Kitchen. And about 6 months into the investment, we found the food as medicine space. So that's what we'll talk about today, and it's hard to even describe the magnitude and the impact that we hope that it will have, but it's very relevant. So been active. We were passive investors at first, but stepped in recently and earlier this year as the active CEO of the company, and couldn't be more passionate about what we're doing.
Well, look, I am also the editor at Real Clear Health, Real Clear Policy, so I know a little bit about healthcare. The United States, its life expectancy is going in the wrong direction. Chronic disease is at a crisis in this country, and in terms of the developed world, I mean, we're spending money on healthcare and healthcare systems. And so we're constantly looking for new ideas, new solutions. You know, a lot of pundits and politicians like to argue and tell you what's wrong. I think the food is medicine movement might be what's right. So why don't you tell us, let's start there and tell us about the food is medicine movement.
Yeah, this is it's a lengthy conversation to kind of unravel, but the shortest version I can give you is my perspective of our healthcare system, and I always have to disclaim this, it's literally the best in the world, but it's not a healthcare system. It's a sick care system, right? And that's how it's built. Once you are diagnosed with a chronic disease, we're going to do everything we can, and it's really miraculous what we can do in many situations. The challenge is we are waiting to get to that point to deal with chronic disease in the country. And as you stated, really one of the reasons I got into this space, there's a graph that I keep going back to. It's one of the first graphs I put together or saw 4 or 5 years ago when we got into this space, but it's the healthcare spending as a percentage of GDP in the country. And it is a straight line up. I mean, we started in 1960 at 5% of GDP. We're now at 20% of GDP that we're spending on healthcare. CDC expects it to be up to $6 trillion we spend on healthcare by 2030. Like it's an overwhelmingly, when you look at it just as an economics guy, it's not sustainable. And
Right.
So all the healthcare pundits are saying, look, we've got to have some sort of transformative change. And to your point, the challenge with the existing sick care system is there's no real motivation to improve itself, right? Until it just collapses upon itself because of the weight of the system. So, and I'm sure you're familiar with value-based care and the social determinant space. What most people believe is that something like 80 to 90% of our overall health has to do with what's called with social determinants of health. The challenge with social determinants, which is housing, transportation, and most importantly, food, is they're not handled by the existing healthcare system, right? They're outside of it. And so now we've got this challenge as an industry of how do you deal with 80% of our overall healthcare problems with an industry that's not built to handle those problems, right? And that's where food as medicine comes in. Food as medicine is largely preventative. However, most of the benefits today are not preventative in nature, they're management. Once you have a chronic disease, they will actually pay for meals to fight that chronic disease, in addition to all the other medicines and hospital care that we currently pay for. But we're hoping that the way the challenge with that is it's not preventative right now, but the reality is 60 to 70% of the country has a chronic disease. So it doesn't really need to be preventative because we have such a massive population that we can manage their current disease state, right? And once we can show the economics, I'm big on the economic side of this. Like, I got into this, and there's a lot of benefit designs out there. Medically tailored meals is really the only food as medicine benefit that shows a positive ROI over a very short period of time. And that's such a crucial thing for healthcare. There was a study that just came out by Tufts the other day that said grocery benefits, we can probably break even over a 25-year period as long as we introduce those. The challenge is payers don't own your health for the rest of your life. So you can't ask them to commit to 25 years, right? Congress can, but as you know, Congress, it's a whole nother bear altogether. So hopefully that's a good enough summary of where we're at.
It's and again, so many things to dig into, like payers, like the current system, like health insurance. But you mentioned something, that is the economics of all this and how our healthcare system, our sick care system, and actually, it's not even a single sick care system, right? It is states have their own systems, Counties have their own systems. You have Medicare, you have Medicaid, you have TRICARE, you have the veterans. I mean, it's all over the place. So we have myriad sick care systems. And look, I'm here in D.C. We're talking about public option versus personal option, access to health care, telehealth. Everyone seems to want the beginning of a conversation about solutions. So stories, right? Everyone can relate to a good story. Are there any stories, any in your personal experience with Performance Kitchen, where you saw someone's health turn around, where you saw someone or data that shows that when you deal with food as medicine, there actually is a good health outcome?
Yeah, I mean, the most personal story I can give you is my own. When I got into this space, I invested in a healthy food company because a lot of other people need that and it'll sell well. Once I got in and started diving into food as medicine, it really was transformative to me to see the impact food can make in somebody's. I'm talking about people with real chronic diseases, with epilepsy and diabetes and heart disease, and potentially reversing these diseases. So I dove in, like I do everything else in investment, and said, okay, I want to see what's going on here. I'm going to start taking my blood test and see. And lo and behold, probably a year into investment, I took a blood test and found out I was a pre-diabetic. And most people don't realize this, but 30 to 40% of the country right now is pre-diabetic. And the challenge with that is 95% of them don't know it. I never would have known until I was a full-on diabetic, and then I'm 5-10 years deep, and now I'm dealing with the symptoms of the problems, blah, blah, blah. So short version is, took my blood test, was a pre-diabetic, said, oh, it was spooky at first, but then I said, okay, well, I'll deal with that 10 years from now when I become a full-on diabetic. About a year later, I took another test, and lo and behold, I had registered as a diabetic for the first time ever. And
One year. At the time when you did this, let me ask you, how old were you? What age group were you?
44 at the time, 43, 44 at the time.
Because most people think about diabetes, type 2 diabetes in particular, well, when I'm 60, when I'm 70.
100%.
But you were a young man.
Young man, and the biggest issue here, and CDC says about 15% of the country has diabetes, another 30 to 35% have prediabetes. So again, we have an entire swath of people that have an oncoming disease that they don't even know about. The other thing that triggered me on this was I went and met with a diabetes doctor right after I found this diagnosis, and we were talking about the food as medicine, and he was somewhat of a pessimist on the space. He said, look, I've been working with diabetics for 40 years, and they just won't change. And I was really disgruntled about the industry that we were in. I was like, And then he said something else. And keep in mind, I had just experienced this traumatic experience of getting a blood test where you have a chronic disease now, right? And he said something else that really hit me. He said, I don't care how good you make the food, they won't eat it. I was like, time out. That's BS.
Look at the size of me. I love food. You make me a nice, healthy plate of food, I want to eat it. But 100%. Go ahead.
I was the same way. Like, you make me a healthy cheesecake, I'll eat it every single day, right?
Yes,
and so it wasn't as much the discipline and the commitment to eat healthy as it was the obstacles that we all face to doing that. The cost, right. The efficiency of it, the convenience of it, all of those things.
The shopping, the budgeting, the planning. My wife does the food shopping in our home, and my wife is a wonderful chef. We're blessed. But It takes time and effort. She works at her. Sunday nights. She works on her menus for the week. Then she shops for the dinners and the lunches. And so, But to your point, though, it does take effort.
That's right. So after that experience, I said, okay, time out. No, I'm not doing that. I tried our meals, but I hadn't gone on a program. And so I said, I'm doing this. I'm going on a full 90-day program to see what it does. And I talked to Mark Hyman about this and other doctors involved. And probably not the smartest thing to do, but I didn't go to a doctor. I said, if I'm going to do this, I'm going to believe in it. Just ate our meals, lost 30 pounds on our meals, and now I'm back to pre-diabetic levels. Like it's.
I gotta ask. I'm sorry. So 30 pounds. How long? Over what period of time?
I think that was probably 6 months or so.
All right, so again, that's what that's what the health experts tell us, and you became a client, so to speak, of Performance Kitchen.
That's right. I became a client, and if I'm going to preach this, I'm going to know that it works and know how it works. And it was such a fascinating process to go through because we try to solve three basic problems, which we talked about in the previous. We have an acronym called CAT, C-A-T, convenience, affordability, and taste. Okay, those are the three reasons we eat what we eat. It's got to be convenient. That's why fast food is a multi-billion-dollar industry. Affordable, that's a challenge. Even fast food. I mean, I've got a family of 6. Even going out to eat at fast food is $60 now, right?
There's 7 of us. I have 5 kids. Same thing.
Yeah, but the third one, which is taste, is probably the most important. If we don't like the way it tastes, I don't care how much crap you put in front of me, I'm not eating it, right? Yes, doesn't matter how inexpensive it is, doesn't matter how convenient. Right. You've got to sustain this.
And I have a 9-year-old who proves that every day.
No, exactly. I've got a 5 and a 9-year-old, so we're in the same boat. So no, that's what it was. And what I found with our meals is when I would go into the freezer, I'm not Performance Kitchen chairman and CEO at lunchtime. I'm just hungry, right? And you have to go into the freezer or fridge or freezer, and you have to have something that you want to eat because this is a process. Our programs are 2 to 3 meals a day every single day for 12 weeks. Right, it's a true food intervention that we provide for clients, but it's really incredible to help the industry solve this space. Because the other reason we like medically tailored meals is, as opposed to other food programs, the challenge with other programs, back to your wife, same thing is I could say, hey, here's a budget to go buy healthy food, but now you've got to have the knowledge, you've got to be able to cook. There's a lot of
you have to read labels.
And it's very, very difficult to do. I'm in the space dealing with doctors every day, and I'm like, hold on, so-and-so said this. What? Hold on. So it's very complicated. So medically tailored meals are phenomenal because they're really just pre-prepared meals shipped to your home. That's all it is. And when it's lunchtime, you eat it. You don't have to read the label. You don't have to be educated. You just eat it. And if you like it, you eat it again. If you like it, you eat it again. If you don't like it, you switch it out for another meal you like, right? And that's really the basic premise. You do something that you can do every single day. But the reason that's so valuable is that this entire industry is about behavioral change. Mm-hmm. And one of the key components of behavioral change is we as humans need an experience with the change that we're fighting for. Because this is hard. Walking through the industry of sugar every single day is very, very difficult, right? So we need something that gives us what we're fighting for. And what that is, what it was for me was, I still remember 3 weeks into my program, back to our boys, mine were 2 and 5 at the time. And I remember I was outside and I just felt like playing with them. Like it was all of this is anecdotal, but that became my why because mine are young. And so I want to be around when they're older. Sure. So it became my why. And now I knew what it felt like to eat healthy. Now that's crucial, because once you know what it feels like, now you can self-motivate and self-educate. Now I can go out and say, okay, why did this work differently than this? Why is this oil different than this? Why, all of the components that allow us to manage our own health. So that's why this is such a crucial process, because food really is the fundamental medicine that we have. And we don't treat it that way in healthcare, but we're starting to right now.
Well, let me ask you this, because unfortunately, all the different healthcare systems, it involves third-party payers and insurance and access and cutbacks and price controls. I mean, this is the mess we're in. You mentioned diabetes. We've been arguing about the price of insulin here in D.C. For 2.5 years now. And so where is the rest of the healthcare stakeholders in terms of insurance, in terms of physicians, patient advocacy groups? Who is getting involved? And it seems to me that you're talking about a 21st century idea on how to get healthy and be and live a happy life. Vox, a left of center journal, just had a piece this week talking about how we talk about politics and power and money and wealth, and really at the end of the day, people want peace and happiness.
That's right.
And 100%. One way to get there is through healthy living. So where is the rest of the healthcare sector or sectors in terms of the food as medicine? Yeah.
I can sum it up fairly quickly with 3 primary sectors. You got Medicare, Medicaid, and commercial, right?
Got it. Yep.
Medicaid, the first state to really deploy this statewide is California. They have a medically tailored meal benefit, which is called CalAIM. It's a variety of different social determinant benefits, but this is a whole other issue altogether. But 40% of their state now qualifies for these benefits. It's just finding them and making sure that people get them, right? So California started this in 2022. That's on the Medicaid side. Medicare is really the leader in the space, because what happened in 2020 is that Congress allowed Medicare to offer these benefits. And they're slowly starting deploying them as supplemental benefits within Medicare Advantage plans. So that, in addition,
and Medicare Advantage plans are exploding in terms of popularity. So
and
this might be part of that. Yeah.
So that's what's happening. And Alignment just came out with a study the other day that said the #1 requested supplemental benefit is food benefits.
Wow.
On Medicare Advantage plans. So Medicare Advantage is the privatized version of Medicare. There's 2 bills in front of Congress that are actually bipartisan right now for medically tailored meal programs. There's one in the House and then one in the Senate just introduced by Booker and a couple of other senators just introduced.
Cory Booker from Jersey, New Jersey, Democrat from New Jersey.
That's right. So there's 2 Republicans and 2 Democrats on that bill. But the good thing is this: it's, to your point, it's bipartisan because it's feeding people, but at the same time, it's saving money. I mean, the economics that we show on a medically tailored meal program is for every $1 you put into food, it saves about $3 in healthcare costs. If we can see that at scale, that's, I mean, in a $6 trillion industry, it's a massive number.
And we're having an argument in this city constantly in Washington, D.C. about the future of Medicare and also Medicaid spending and spending overall. And we just had the Inflation Reduction Act that passed, and many healthcare stakeholders didn't pay much attention to it, but it's talking about cutbacks and price controls and taxing different healthcare therapies. But what you're talking about is even if you add a benefit, people think, well, that's going to cost more. But no, not if you stay healthy, right? The point of healthcare is to be healthy, and that is a shift in thinking and a shift in policy. That is, you are at the ground level in the trenches on this.
100%. And let me describe to you one existing situation that's like that. Our sick care system, as I stated from the beginning, is unbelievable. They can create drugs like the GLP-1 drugs, Ozempic, that can literally curb your appetite. They really are amazing drugs. Yes. The challenge is they cost $1,000 a month, every month for the rest of your life. And they have no behavioral change component to them, right? From what I understand, the second you come out the drugs, you go right back, right? However, a food benefit probably costs 50 to 75% of that if you were to pay for every single meal of every day for that person for the rest of their life. It's 50 to 75% of the cost of the drug. right? It's just that's the economic situation that we're in, is that the sick care system does what they do. They come up with a masterful solution to solve the chronic problem that exists.
Right.
Right.
And you made this point. There are stakeholders in the systems, in the sick care systems, that there's an economic advantage to the status quo. But also, I think there's an ideological problem here insofar as conservatives, Republicans shy away from health care, don't like the idea of adding benefits to Medicaid. I've had this argument, I'm a right of center guy, and I've made the argument for years that we should be employing food stamps, SNAP, differently. But my Republican friends want to talk about cutting it. Yeah. And I'm like, no, use it better. And
100%. And there's that debate going on right now. Marco Rubio just proposed some reductions to the SNAP program because, again, one of the challenges with SNAP, and this is where it gets complicated, is we've got, 40 million people on SNAP, where it started as a food security program.
Yep.
And it's largely been successful at curing food insecurity in the country. The challenge is we weren't insightful enough at the time it was created to limit what we provide. And so now one of the top products purchased on the SNAP program is sugar sweetened beverages. Yeah. And so that's what Marco Rubio wrote a bill to remove those from SNAP. My expectation is that'll never happen because we've already created the program. Now we have to take it away. If we would have thought about that from the beginning and said, let's do only healthy meals, the challenge with the existing SNAP program is we're feeding people that are probably the most vulnerable in our society and simultaneously, inadvertently, creating chronic disease in the process.
And it's costing the healthcare system, the sick care system,
100%.
More and more money. The interesting thing about this is that, maybe how you reform SNAP, how you reform our healthcare, sick care systems is with incentives. You tell patients, let's say a private insurer decides to cover food as medicine, but you give them an incentive. Look, at the end of 6 months, if you're 15 pounds lighter, if your cholesterol levels are lower, if you are pre-diabetes but your sugar levels have returned to normal, well, then we're going to give you a percentage back. We're going to give you a discount. There's ways to do this.
Well, and that's where the challenge with giving percentage back is a good portion of people are not paying for these benefits on Medicaid, you know what I mean? And so the challenge with this is how do you solve this within the current economic system that we have? And one of the key components I already discussed with the current economic system is that Medicare Advantage, privatized Medicare, only holds these, it's the most successful portion of Medicare right now, but it only holds these customers for 2 to 5 years on average. And so they can't really commit to a long-term benefit that's going to get you healthier 5 years from now. Again, this is why medically tailored meals are so important, because they will see an ROI within the year that they're actually providing the benefit. And once we show that at scale, I trust the economic system that insurance companies aren't stupid. I mean, the data that comes out, there's a tough study that just evaluated the top medically tailored meal programs. Basically, it said you can save about $2,200 per patient after the cost of the meals. Okay. Now, the reason that's relevant, Kaiser just came out with a correlating study that said the net profit of Medicare Advantage plans, not net profit, the gross margin before administrative expenses was $1,700. So just put those side by side. You can save $2,200 by feeding somebody after the cost of the food. They're only making $1,700 right now. You could literally double to triple the gross profit of a MA plan by offering this benefit. Once you do that, I promise you the economic engine will take off and they will all get into space.
Let me ask you this, because I'm sitting here, I'm getting frustrated because again, look, I do this podcast and I do radio shows. I'm an editor at Real Clear. And again, it's easy to talk about the problem and I get excited about these solutions, but I'm going to ask you this. I'm going to ask you a problem question. Yep. You're in the space. You have a successful business. You're doing it. You were a client, a patient. It worked for you. All the data, all the evidence, both empirical and personal, you have. What is the biggest barrier to helping this to blow up in a way that can help more people?
So first of all, let me agree with you that I don't like the industry of everything's wrong. Everybody else is screwing up.
Everyone's wrong.
I'm like, okay, we'll do something about it. So that's what we've done. What we've done is we followed the benefits that exist right now. There are millions of people nationwide that qualify for this benefit. We've actually created a tool. We could actually put it in your show notes. That's what we call a benefit locator tool. That's zip code by zip code in the country, where people that qualify for benefits can go on, look up their zip code, and see if they qualify for a benefit. If you're on Medicare, specifically Medicare, because that's where the majority of the benefits are, Medicaid is state by state. You can go on there and it'll tell you whether you qualify for benefits or not. So it really is a cool tool. So to your point, we're doing something about it. We're providing meals today for seniors that are diabetic, that are pre-diabetic, hypertensive, all of these disease states, that we're actually helping them get healthier. So the key to us, and again, just imagine what we're trying to tackle. I mean, this is a $4 trillion industry that we're trying to innovate within. But the key, I think, is getting the data. Everybody's looking for it. Congress is looking for it. The Medicare Advantage plans, the states are all looking for the data that this is an effective benefit that can be introduced. And we know it is. The challenge with this is it's not as simple as a syringe, right? You can't issue a syringe that's the same dose every single time that works every single time. With food, I mean, you and I can sit here, there's 700 different variations. If I said to you, Jerry, hey, I know for a fact that a vegetarian diet would work for you, you'd be like, maybe, I'm speculating here, but I would say I'm not doing it, right?
If it's convenient and it tastes good,
well, and that's
I'm
the
with
thing.
you.
We have to meet people where they are. So it may be a Mediterranean diet for you, or a low carb, or whatever it is. But the key component is you have to design a program that works for you. And once it does, but the question is it 1 meal a day? Is it 2 meals a day? Do I need to push 3 meals a day to you? Right? Is it all these different programs that are out there? We've got to find the data on what's most effective. And that's just going to be trial and error with these benefits that exist. So the good positive news is the industry is moving in this direction. The food as medicine industry is here. And here's another big component of this. I don't want to be detrimental to the sick care industry, but the challenge, most of the people in that industry really want to do a good job. The challenge is they're built on a certain framework that it's hard to innovate within that framework. However, what's happening in the market right now, and you've probably seen this, is there are retailers getting into the space heavily. And I'm talking Amazon, Walmart, Kroger, which we just made an announcement with. Now it's a different thing because Bain just came out with a study that said, or a report that said 30% of the $6 trillion healthcare market is up for grabs by 2030, which means alternative versions of care. So retailers are saying, if there's $2 trillion up for grabs, we have relationships with our customers twice a week. Why don't we get into the space, right? And all of them are now pushing into the space, and you can imagine they are providing social determinants, right? So Kroger on a daily basis is providing food to millions of people nationwide. Walmart is doing it. Amazon is doing it. So you've got some really interesting things happening in a broader macro standpoint where you've got these mega retail CPG companies that are getting into the space of healthcare that I'm very hopeful they will have an impact on transitioning the healthcare industry away from the sick care system and into healthcare, true healthcare.
You know, as I'm talking to you, I'm sitting here and my mind's going crazy. First of all, I can't wait later in the day today because of you. I'm going to call my parents. My dad has type 2 diabetes. They're both on Medicare, and you know what? It's a struggle with my sisters and my brother. Two of my sisters live near my mom and dad, and diet and meals are a problem. I'm going to talk to them today about. I'm going to go today and talk to my parents about this.
I've got that same experience, and again, that's what we tell people is luckily a good portion of us don't have a chronic disease, but every single one of the people listening to this knows somebody who does. My dad was in the same situation. My dad was diagnosed with early onset Alzheimer's. He went into the doctor, they sent him to a nutritionist, and she sat down with my mom and said, okay, here's your book, your Bible on how to cook for him. And it's 3 inches thick. And it's overwhelming, right?
It is. I know it. Again, from personal experience, I know it's overwhelming.
Yeah. And so what we like the ability to do is just to help take some of the burden away from eating healthy. And if we can do that successfully, then we can start making a dent in this problem and start transitioning to more of a healthcare system than a sick care system. And again, back to the advocates, there are massive, massive advocates in this space. It's just nobody knows how to solve the problem. And we believe that medically tailored meals is a cornerstone of shifting our sick care system into the true preventative healthcare environment.
Again, two of the things I'm thinking about is that, I read the book Moneyball. I watched the movie with Brad Pitt. I loved it. But, baseball had to change how they viewed stats and productivity and wins. And so it literally changed the game. What you're talking about here is a Moneyball for healthcare. Is 100%. What you're talking about ultimately. And then the last thing is, this is and I'm going to use this phrase, and I'm being, many a truth was said in jest, because of our cultural debates nowadays. But this is a safe place for bipartisan agreement.
Oh, 100% it is.
Because every ideology here gets something.
Here's the risk of it. It sounds like another entitlement program. That's the challenge with it. That's what it sounds like. However, when you really dive into the economics of it, and I've struggled with this personally because I'm a big teach a man to fish person. I can't stand the idea. I think we are doing a disservice to people to enable them or not enable them to manage their own health. That's why I'm a big proponent. Our benefits are maxed out at 90 days. So it's a 12-week benefit, 3-month benefit. I'm not a big fan of providing these year round. And the reason why is because we steal the opportunity from people to manage their own health. I don't like that model. So I would rather.
90 days is a great number too, because we know that you can help. Right, like if you abstain from alcohol for a month, it can reset your body. So 90 days is giving patients and giving folks 3 times what they need to get healthy.
Well,
to forge good habits.
This is the rule that we use. There's a rule called the 2190 rule that says you can break an old habit with 21 days of habitual action. The challenge is once you break it, you're sitting there. So it takes a full 90 days to establish a new habit. And that's really the objective is let's break the old habit first. And then let's establish a new one of eating healthy. And more so than anything else, one of the gifts that I believe we have the ability as a company to give through the insurance companies that are offering this benefit is by shipping meals to your house. And again, that's how easy this is. Once you qualify, we literally ship meals to your house every single week.
I'm calling my parents right when I get up. When we're done, I'm calling my mom and dad.
You walk into the other room and pick the meal you want to eat that day, and then next week another box. You know what I mean? It's really, but the gift we have the ability to give is we truly feel like we have the ability to give the gift of health to somebody without any education, any work on their part, right? And somebody described to me the other day, they said it's kind of like these workout programs that they give for free. I'm like, not really, because I don't care if you gave me a free gym membership. I still got to get out of bed.
You got to get out,
you know what I mean? So this one, literally, the only ask we have somebody is get out of your bed, walk into the freezer and get the meals, heat them up. That's it.
Yeah.
Right?
Yeah,
so it really is a great gift we have the ability to give.
Listen, I'm going to let you go in a second, but again, I'm going to be. Remember those old commercials? I'm not just a hair club member. I'm also a user. I'm going to find out for my own personal life how this might be something for my wife and I, and for my parents. But again, in terms of convenience, I belong to a gym and I never went. Yep. So I ended up just buying weights and putting equipment in my garage because I can roll out of bed and just go to the garage.
It's all about making it. I mean, look, this behavioral change stuff is hard, and it's hard for a reason. It's because and whether it's intentional or not, we have a massive food industry that, sugar is one of the most addictive substances on the planet. It really is.
Yes.
And it's really, really hard. So the easier we can make this on people, the more benefit society overall is going to get from it, right? I mean, really where this industry popped up is through COVID, and we now realize that we are absolutely sitting ducks as a country with the chronic disease state we have for any rampant disease that comes through. Like it really is it's almost a national security issue at this point.
Sure. Yeah.
Because we're in a terrible metabolic state throughout the country. And again, it's not really our fault. It's very, very difficult to work within the environment that we're given. So for those that we can help, we want to be able to help. And the key component of this for us is, I believe, the economic incentive that private insurance companies have to provide these benefits.
Yeah. Before I let you go, though, I have to ask you about Dugout Ventures because some of your partners are ball players who I've watched. I love baseball. I'm a varsity football coach. I coach football. I coach baseball. Tell us a little bit about Dugout Ventures.
So Dugout, we created, golly, I think it's been 8 years ago or so now, where a bunch of ex-players, David Ortiz, Torrey Hunter, Vernon Wells.
I'm a Yankee fan, and I still love that you have David Ortiz as a partner.
He's in between two big Yankees right now with A-Rod and Jeter.
That's right, and Derek. That's right.
Barry Larkin, Nolan Ryan. We've got some real heavyweight guys involved. But the core component of it, we had an investment group, or still have an investment group, Dugout, to invest in early stage consumer brands. And then we found this space. And all of my partners, what's great about them is they're so passionate about giving back and helping. And once you find this ability to really make a difference and impact that's above just the economics that you can make on it, it's really a bug. And we believe that we can actually help solve this problem, because we do believe that it's a healthcare problem, but it's also a consumer problem where people need to believe in the brands that they're eating and have confidence in them. And so it's a fascinating space. It's very, very exciting. The momentum is building every single day. I think what the key components of it is showing the economics to all the different vested parties, to Congress, to the payers, to everybody, to show that there's a positive ROI on this space. Once they see there's a positive ROI, I think it truly is bipartisan. Now, all of a sudden,
And again, I've been working in this in healthcare policy for 2 decades, and I'm excited about this. I don't know if you can tell. I'm literally jumping out of my seat here. I want to have you back because I think we just started a conversation about this. I think this is fantastic. This is exactly why we do the Business of America podcast, because you're one of the guys, one of the men in the arena. You are doing something, not just complaining and the rest of it. And again, I'm so happy. This is one of our early shows still. I think this is episode 5 maybe. But this is it. You've set the tone for every show after in terms of the doers and those men and women in the arena. So we've been talking to Mark Walker, CEO, Performance Kitchen, also Dugout Ventures. He's the managing director of Dugout Ventures. This is exciting stuff. And again, this is exactly the issues and topics where if we decide to put aside our biases and our kind of old way of thinking, we could change culture, change our diets, even change our political culture if we wanted to. So, Mark, I appreciate you joining us. Thank you so much.
Of course, Jerry. Glad to be with you.
This has been the Federal Newswire's Business of America podcast, hosted by Jerry Rogers. Check out the Federal Newswire's family of websites, as well as their social media stream.